Hello and welcome to Community Health Journal. We begin today with the opening of a new emergency service in the Tri-Cities. Kadlec Regional Medical Center opened the region's first freestanding emergency department. It's an around-the-clock ER with emergency-trained nurses and doctors. The days leading up to the opening of the new ER brought final training and education for staff as well as the community. With the blue-clad Kadlec ER staff lending full support, a ceremonial ribbon was cut, signaling the opening of Kadlec's new ER in Kennewick. With 15 private rooms and overflow to accommodate 3 more, the new Kadlec ER is new to Eastern Washington. The first of its kind service will operate 24/7, with certified nursing staff, doctors, and technicians focused solely on getting patients treated effectively and quickly.
Freestanding emergency departments are not new to the nation. They actually started back in the 1970s. But it's been in the last 10 to 12 years that they have had a resurgence of them across the nation. We were fortunate enough to go around and visit some of them to get some ideas on what we wanted to see in ours. And basically, a freestanding emergency department is brought to the community so it alleviates some of the overcrowding that you find in the hospital-based ERs. With only 65 emergency room beds in the Tri-Cities, we're here to offer 18 additional beds here to offer to the people of the community. As we kicked this off, we had a vision of what we wanted this ER to look like, and we wanted to establish a new culture in emergency room care. This great team that I stand in front of, who's been working so hard to make this day and this whole thing possible, they are ready and excited to reinvent your emergency room experience.
Carla May is the manager of this unit, a project she has been living for nearly 2 years. The design of the ER was built around the patient-focused processes developed by Carla and her team.
I've been involved at other places with other designs and builds where we come into a room and a plan is set down in front of us and says, we think this is going to work, give us some input. This was done totally differently, and we had several of us a year ago who went and traveled, looked at places in other parts of the country, looked at other freestanding emergency departments, were able to look at the best practices and take from them and pick some from one and others from another. And then we were able to come back and we went through some lean process training and others so that we would really know what our processes should be.
Kadlec leaders are excited what the new service brings to this part of the community for people who have made the trip across town to use the Richland ER in high numbers.
We hope that you never have to be a patient, but you'll find that if you have to come use this facility, it will be a different kind of emergency room experience. It's all designed around working to make the patient the focus of attention and get them in and out as quickly as possible, and yet make sure that their needs are met.
Kadlec has worked hard to educate not only the community about the service, but neighbors too. With Southgate Elementary right across the street, Kadlec staff brought the kids in to see firsthand what happens here.
We've been excited about that all along. So to come into the facility and see exactly what it is inside, and for them to know that they have a great healthcare facility in their own neighborhood and understand some of the things that'll go on here while we're in school is very important. It's all about learning.
And the new service is valued also for its economic benefit, bringing an additional 45 jobs to Kennewick and the Tri-Cities.